Diabetes. A rising problem. Over the last 2 decades, there has been a significant increase in the number of cases of diabetes in India. Recent studies have shown that over 62 million people in India suffer from diabetes, and the number is still on the rise. It is estimated that by the year 2030, 79.4 million people in India will suffer from this condition. Diabetes is a strong risk factor in the development of heart attacks, stroke, and kidney disease. Once the diagnosis of diabetes has been made, treatments such as tablets and insulin injections may need to be taken. Strict lifestyle measures will need to be observed. In this video, we shall briefly review what diabetes is and how it can be managed at home. Before we discuss diabetes, let us take a look at how blood sugar is used by the body. When we eat our food, the carbohydrates in our meal are broken down in the stomach to small glucose molecules. These glucose molecules are then absorbed into the bloodstream, from where they enter the cells and tissues to provide energy. An increase in blood glucose levels leads to the production of a hormone by the pancreas, called insulin. Insulin is secreted by the pancreas and is responsible for allowing these glucose molecules to enter the cells. When the glucose enters the cells, the amount of glucose in the bloodstream falls. If the blood glucose levels remain high, it can lead to a condition called diabetes. Diabetes is a condition where the pancreas cannot produce insulin, or the body does not use insulin properly, which leads to high levels of glucose in the blood. What are the types of diabetes? There are 2 types of diabetes. Type 1 diabetes is usually seen in children. Type 2 diabetes is seen in adults. What causes diabetes? In type 1 diabetes, the pancreas fails to produce insulin. This is because the cells in the pancreas do not work at all. In type 2 diabetes, the pancreas does not release sufficient amount of insulin, or the cells and tissues in the body do not respond to insulin that is produced by the pancreas. This condition is known as insulin resistance, which is a strong risk factor in the development of heart disease and stroke. Other causes of diabetes. Diabetes is common in people who have a family history of the condition. It is also seen in people who are overweight and who do not take care of their health. Diabetes can also be seen in women who are pregnant. This is known as gestation diabetes. Symptoms of diabetes. Many individuals may not be aware that they suffer from diabetes. Those who have high blood sugars can experience any of the following symptoms. The symptoms are increased thirst, excessive urination, tiredness, weight loss, dehydration, or blurred vision. How can diabetes be diagnosed? A simple blood test is all it takes to diagnose diabetes. Ideally, the blood sample should be taken on an empty stomach, following an overnight fast. Fasting glucose levels exceeding 126 mg per deciliter indicate diabetes. A random glucose level exceeding 200 mg per deciliter also indicates diabetes. Diagnosis of diabetes can be made through a test called the oral glucose tolerance test. How can diabetes be treated? The best way to manage diabetes is to manage your lifestyle. These simple steps should help you make a start. Step 1. Maintain a healthy diet. Keep your intake of sugars, sweets, and rice as low as possible. Avoid eating vegetables such as potatoes and beetroot. Keep your intake of salt and high-fat foods low. Eat more wheat and high-fiber foods. Step 2. Exercise regularly. Performing regular exercise can help maintain a healthy body weight and keep diabetes under control. Young patients are recommended to perform moderate to high-intensity exercise, such as running, swimming, cycling, or similar form of sporting activities, 5 to 6 times per week. Older patients must walk regularly, preferably at a brisk pace. 45 minutes to 1 hour a day is often sufficient. Step 3. Maintain a healthy body weight. The heavier you are, the harder it is to treat diabetes. Weight loss is extremely important when it comes to treatment, and maintaining a healthy weight is essential. Ideally, having a body mass index of less than 23 is recommended. For more information on diabetes, visit our website at www.heartsense.in.